We have tested 3,255 samples in the last 24 hours. 133 people have tested positive. This is the number, again, a repeat number of the number we got yesterday. The cumulative number of tests conducted so far is 121,956, nearly 122,000, with a total load in the country of 3,860. All the positive positive cases are Kenyans, with 88 being male and 45 being female. This trend has continued throughout the reports that we have made, and we need to understand why so many men are getting this virus. If we were able to drop the number of men to the level of the number of women, you can see that you drop the number substantially. And I think a bit of it has to do with behavior, that women essentially are exhibiting a more careful and more consistent approach to this disease than our men. And I think we as men must also adopt the same attitude. The 133 positive cases are distributed in counties: Nairobi with 86 cases, Mombasa 27, Kiambu 7, Busia 5, Murang'a, Kilifi, Kajiado, Migori 2. In each of those, Machakos and Murang'a County have 1 each. In terms of the sub-counties, Westlands in Nairobi is the lead today with 13, Embakasi with 10, Makadara with 9, Langata 8, Embakasi East and Roysabu have each got 5, while Starehe follows with 4, among other counties that have registered, sub-counties that have registered various numbers. The 27 cases in Mombasa are essentially from Mvita with 16, Kisauni with 6, Nyali with 3. We are delighted to report that we have discharged 40 patients from various hospitals, bringing the total of the recoveries to 1,326. Unfortunately, we have also lost 1 more patient to the disease, bringing the total number of those who have perished and succumbed to this virus to 105.